There are a number of persons who we've identified over years who are in need of joint replacement surgeries. And the number is ever increasing. So ever so often, what we try to do is to take a weekend and we, with an entirely local team, we try to do a number of hip and knee replacement surgeries. This one so far has been the biggest undertaking by a local team. We started on Friday, and it's on Friday, Saturday, and Sunday, an entirely local team, and we're aiming to do 27 joint replacement surgeries in total. I think the breakdown is 9 hip replacements, and the remainder are knee replacements.
So everything like us has a lifespan, right? So when you do a joint replacement surgery, we, we will tell the patient we expect that you should get about 10 years to 15 years out of this joint. And depending on how you cared it and how you cared yourself, because remember, you can get infections, you can get other problems down the road, not necessarily directly related to the joint or the surgery, but because you have a bad tooth or you have something else that allowed bacteria to seed to another spot. And sometimes we do get either aseptic or septic loosening of the joints. Those cases will sometimes need to get revisions.
Joint replacement surgeries, particularly of the hips and knees, are probably in the world one of the most performed surgeries. It's literally a life-changing surgery. Persons, many persons, as we age, we develop arthritis, and some persons, it gets so severe that it becomes debilitating. Even their normal activities, even if it's just someone to move around their home, it becomes a problem. Some of these persons are wheelchair bound or they can't walk without assistance. So the joint replacement surgery is the definitive way to treat arthritis.
My condition before the surgery was like pain, 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 non-stop pain all the time. Moving around every day with pain. I think it will benefit good because I'm going to be able to move around and do stuff better for myself, and I can't wait to do the next knee.
Pre-op is sometimes even more important than post-op, meaning you need to be educated, you need to know what you're getting involved in, you need to know what are the things you will be doing after the surgery is done. And once we can educate you preoperatively and do adequate selection of the patients, then the post-op is much easier.
I think for both patients and surgeons, a very satisfying operation because for the patient, the pain is a horrible and debilitating thing, and it does very well to uh, eliminate the pain in many cases. And for the surgeons, the satisfaction comes from, like, I can remember one person in particular, out of hundreds that we have done already, but there is one lady in particular who came to us, and she was wheelchair bound, and she was very frustrated. She'd be crying. She couldn't move around. She lost her independence. And within a year, we did both of her knees. Both knees had the knee replacement. Now she's up, moving around. She would always pop in to show me how sprightly she is now and how well she moves. So it's a life-changing operation.
We are getting the patients up, almost all of them, same day after surgery. We've actually gotten to the point where we're sending some of them home the same day, which is an advance that, when I started doing joint replacements in Guyana, which was that same year, 2003, patients used to be in the hospital for like 5 days. And as the years went on, we reduced it to 3 days and then 2 days. And now we're doing same day surgery. You come in the same day and you get to go home the same day. So we've really moved forward with our joint replacement program, or arthroplasty program, and we're hoping that we can even improve on some of the things that we are doing.